this is a time where it's normal to worry. I mean, we're all worried. We don't really know what's going to happen. Worrying is normal. But to me, there's a distinction between worry and anxiety. So anxiety is when the worry gets out of control, when you can't stop worrying.
So you and I discussed a couple of topics that us as the community health workers at NKCDC kind of heard coming up within the community over and over again. And one of them was the anxiety around losing your routine. And not just losing your routine, it's losing your routine with this added threat of getting sick, right? So you run into this feeling that, okay, if I even try to keep some sense of routine and get outside and do the things that I'm used to doing, I could potentially get sick, right? So you have rules telling you that you can't continue your routine, and then you also have this virus that is making it more difficult to stick to any kind of routine.
I mean, I think for many folks, they're really in an extremely, in a no-win situation where, they're getting mixed messages. So they're being told, you got to stay home because that's what's best for you, and that's what's best for your family members, that you're not going to bring something home and infect them. And then at the other hand, if you're an essential worker, or even if you have to earn a living and you still have a job, you got to go out there, or even if you're somebody who just wants to make a difference and you want to help your community, and you want to give out meals, or you want to check on people, then so doing the right thing, sometimes working and checking on others, that puts you at risk and may put other people that live with you at risk. So if you stay home, you don't feel entirely comfortable. If you go out, you don't feel entirely comfortable. I mean, all in all, there's just a lot of discomfort right now. And it's hard every day to get up and say, okay, we're going to do this again. And hopefully, this week will be better than last, and the pandemic will be behind us soon, and we'll be able to get back to normal life. But this is already dragged on for a couple of months now. And the likelihood is it's going to go through the end of June in the Philadelphia area, where people are going to be very cautious for a while. And then it's going to be a while for all of us to feel safe and normal again. This is just a long process, and where we have to really tolerate a lot of discomfort.
And for the community health workers, for anyone that isn't aware of what we do, it's our job to connect with our community and provide resources and help, fill the gaps that we see in services available to our community, right? So we were drawn to this job because it's just in our nature to want to help other people, to want to be, a connector to guide people to the resources and services that they may need or that they're entitled to. And now we can't do that because there is that fear of getting sick. And I know for me, like, I would have been out volunteering more, but I knew that I had to see my mom on a certain date, and I didn't want to risk getting sick and passing it on to her. So there is a helplessness that comes along with that, because it feels as though I'm just like watching out my window at this worsening situation, and I can't get outside to help in any way. That's a big discussion within our group of community health workers, but I imagine that's a feeling that is pretty widespread across the neighborhood.
I mean, yeah, absolutely. And I think the community health workers may have it particularly hard, because you guys are out there, accustomed to knocking on doors and really engaging people where they live. I mean, that's why you went into the work that you're doing. And now you feel sidelined. I mean, actually, many of us feel sidelined, and being at home feels like we've just been, we're, like I said, an eternal weekend, but it's not a very comfortable weekend. You're just kind of stuck at home. And so the challenge has been, how do we find ways of continuing to make a difference to others, doing work that's important to us, that without having the luxury of going out of the house, or if we're going to go out of the house, to do it in an extremely cautious and safe way. And it becomes, you know, a challenge of creativity. How do we sit in our homes and think as creatively as we can? How do we connect with the people who are, you know, on our block or in our building? How do we make sure that they're okay? How do we make ourselves helpful to them? And so, you know, we have other technology. We have Zoom, and we have Facebook, and we have the phone, and so people make full use of those things. It's not the same as, you know, seeing someone and shaking their hand and getting a feeling for, kind of a more in-person feeling for how they're doing. But we do the best that we can. Certainly, we know that lots of folks now are alone in their apartments, and they're not feeling great, and maybe they're feeling helpless. And so for those of us in the helping professions, we have to figure out ways of not letting our sense of helplessness infect them, but instead to bring a more hopeful spirit to them, to show them that there are possibilities, that life is going to get better, or that their life now can be made better. And that, most importantly, that people still care. They may be in their own, you know, separate residences, but they still care. And that they have, you know, the folks that are alone in their houses and their apartments haven't been forgotten. So to me, what the community health workers, the connectors, do is more important than ever, because you are very caring people and you make a tremendous difference. And now you're in a way, you're kind of have your hands tied, because you can't go out and do exactly what you need to do, but the quality of your caring matters more than ever. So I know you have that, you know, I know that you know that, Chris.
And there are people in our community that are not alone in their homes, which presents a whole nother challenge, right? Especially for parents that now have to manage, you know, their jobs, as well as being now a teacher and a parent, like all of these things all at once. I've never been so thankful that I didn't have children, but I can't imagine with the added stress of now you're suddenly a teacher as well, and your children are home when you didn't expect them to be, without any time to prepare for it.
Really, it's really tough. I mean, my kids are adults. They were out in the world. My son is now back home with, you know, living downstairs. So that's a different type of adjustment. But for those of us who are caring for parents, caring for children and having to do homeschooling, I mean, you end up doing two jobs every day. I mean, you are doing your best to teach your child. You're getting all this direction from the school district about what you should be doing if you're a good parent, and yet you're trying to juggle other household responsibilities and maybe some work responsibilities if you can do them from home. And what I hear from lots of folks in that position is they're, you know, if they have a spouse, and they're kind of switching off from the spouse, who's with the kids and who's doing other things, or they're spending the day with the kids. And then when the kids finally settle down, then they're beginning their work day for their regular job. So they're doing this like double shift, and they you know, that you could probably pull it off for a week or two, but week after week is just exhausting. And then they feel guilty. They feel guilty that they're not doing all that they should do for their kids. They're not doing all they should do for their job. They're not doing all they should do for their spouse. They're not doing anything to take care of themselves. And they begin to wear out over time. And really, my advice to those folks are just lower your expectations of yourself. I mean, this is a tremendous amount for our society to ask of you, to be both, you know, to do childcare, to do teaching, to do working, you know, to be all the things that you want to be, all the different roles, but to do them all at once within a household, within one day. I mean, it's too much to ask. So again, we have to just expect less of ourselves and just feel good enough about muddling through. Good enough is good enough, and not ask more of ourselves and not beat ourselves up in the process.
And as much of an emotional challenge or mental challenges may be for the parents, I'm sure the children are feeling some kind of anxiety or some kind of stress, right? And depending on the age of the child, they may know what is happening or they may not know what's happening, but I'm certain they know that something is different. So do you have any advice for parents that are trying to manage their children's anxiety?
Uh, I mean, I say good luck because your children are going to be anxious and they're going to act up more and they may have trouble sleeping and they may be a little bit needy and they may even regress a little bit and act younger than they are. And all of this is normal. This is kids just having difficulty adjusting to the situation. I have one psychotherapy client who is caring for his kids at home. He has a 5-year-old and a 9-year-old. And he basically struggles with them all day long, particularly the 5-year-old, to get them to do their homework. And I finally just said to him, just contact the teacher and say, this is just a losing battle here. There's no point in having a power struggle with your kids. And it's not because the kids hate homework so much, but the kids are very anxious and they don't want to settle down and do mathematics. They're feeling all agitated, and that's not conducive for good learning. And it doesn't make sense for a parent. And this guy is a big guy. We're going to put these kids down in the chair and make them sit there. It's just not worth it to have that sort of struggle. At a certain point, the best parenting is not to do the homework rather than to do the homework with them. And that, has to be worked out with. The teacher's expectations have to take into account who this kid is, how the kid is reacting to the situation. And that's, being able to maintain harmonious relationships between a parent and child is much more important than whether the child, be able to master some sort of mathematical technique. And so we have to be very reasonable all around. The parents have to be reasonable with their expectations of themselves. The teachers have to be reasonable with their expectations of the parents, and the children have to, they necessarily have to kind of put up with all the adults. But they, it's hard for them to lower their expectations. They have certain needs that need to be met, and we have to do the best that we can for them. I kind of add one other thing that occurred to me as you were asking this question, Chris, and that is when my kids were growing up, I had a pediatrician. He had a saying that he used to love, and that was, if you have a 5-year-old, if you have to explain something to them, you use 5 words. If you have a 7-year-old, you use 7 words. And the idea was parents often feel like they've got to explain too much to kids and they talk too much, that kids don't need long explanations of what's going on with the pandemic or why they're not going to school. Kids need short explanations with a lot of reassurance built around those explanations. And so for kids to know that the parents are going to make sure that things are all right, no matter what happens, that's what kids need to know. They don't need to know everything that's going on. So more reassurance, less talk was always what our pediatrician said to us.
Yeah. At what age do you think that stops? Because my supervisor Lizette is listening, and now I'd like every email to be 32 words or less.
there you go. It would probably take a lot of time if there were 32 words or less. I think it stops when kids really begin to become a little bit more conscious and aware and begin to think about the world in a different way. And so that would be like 10, 11 years old. And for some kids, 9.
And that of course is a joke, but there is a similarity between the student or the children that now their home is now their classroom, right? And that is challenging. And I'm sure that is part of the reason why it's challenging to get the children to do their work, is because they're like, I'm home. What are you talking about? This isn't a classroom. And now as adults, we're experiencing the same thing with our work, right? Now we're at work, but our work is our kitchen or our living room or our dining room. And maintaining a healthy work-life balance, or even figuring out what work looks like at home, it is challenging for us.
I think it's challenging for everyone. I mean, we all have multiple roles. You know, we're all workers and family members, and our family roles may have lots of different aspects to them. And really, I mean, what happens, what I've heard is that when people are working at home, they tend to work all day long. They don't stop. They get up in the morning, they start working, and they drop into bed at night, having worked the whole day. And I think we really need to do what we can to separate our work lives and our family lives as much as we can. And that means, you know, schedule portions of the day, and even assign spaces in the house that are work oriented, and then other parts of the day and other spaces in the house that are family oriented. And what I've tried to do, you know, myself, I mean, and I don't have young kids, but just it's really for my own mindset is when I'm working. So now I'm working and I got my nice white shirt on, and as soon as 5 o'clock comes, you know, just like I would if I were to my home clothes. And once I always find that once I get in my home clothes, it's kind of like my tension level goes down immediately, even though all I've done is change my clothes. But it also means at that point, I'm not going to work any longer for the rest of the night. So to just create spaces in our lives which are separate from work is really important. It helps us to concentrate on work when we're in the workspace, and to be with family, and to be more relaxed when we're not at work.
I've tried and have been pretty successful throughout the past, I don't know, I don't even know how many weeks we've been home now, to maintain like a bedtime as if everything was normal, like knowing I would have to wake up. If I would have to wake up at this time to commute to work, I'm still waking up at that time to try and like stay in that rhythm. And every morning I act as if I was going to commute to work. And I get dressed just as I would every single morning. It feels kind of crazy sometimes because I'm sitting here in the kitchen with my shoes on all day and I'm not going anywhere. Like, but it's been helpful to do that, to kind of say like, I'm going to work now and get everything ready.
I think it makes sense. I mean, it kind of, again, it puts you in the right mindset to actually now, okay, now I'm going to be productive. I dare say that if you were sitting in the kitchen in your pajamas all day long, and maybe in a bathrobe, you know, I'm not sure you'd be exactly ready to work in exactly the same way. But you're preparing yourself by putting on your work clothes and putting your shoes on, and you know, and then when you go upstairs, get out of your shoes and get out of your work clothes and get into the more relaxed mode.
I physically close my computer. That is what lets me know that the workday is over. So even if I'm going to use my computer again in a few minutes, I still close my computer. This week, at the end of the workday, I started to actually just walk around the block one time, like close my computer, walk around the block, to create even more of a separation. And that's been pretty helpful as well.
Yeah, I mean, closing the computer is like the curtain coming down at the end of a play. Boom, play's over. Go home now. But you're also pointing out something which I have felt. I mean, I usually take to work, and I've got like a half-hour train ride. And going and coming, you know, going to work and coming from work, and that train ride was where I, you know, on the way there, I would sort of get ready. There was be like a transition into the work mindset, and then on the way home, I would be clearing my head out of all the tension from the day. So, you know, if you're going from upstairs to downstairs, you don't have that transition space. So you've got to create something which may seem more artificial, but I hopefully will work the same way. You want to make that transition into a different mode of being.
And so we have a document that you would put together for us that I hope somebody is sharing on Facebook and in this chat here. And you had some tips at the end of this document on what you can do when you're feeling different things, right? And a lot of them we have already gone over in here, but the first one was when you were feeling anxious. And you have a paragraph on what you can do to decrease your anxiety. One of them says, are these thoughts realistic? So I don't think when you're in this, if, at least for me, when you're in a state of anxiety, whether or not those thoughts are realistic, don't even come into your head, because you feel for sure that they're real, right? No matter how extreme that feeling may be, to you in that moment, it's real. So taking that a second to acknowledge that, or question it all, is this realistic, can help break that feeling.
I mean, this is a hard one, and this is a time where it's normal to worry. I mean, we're all worried. We don't really know what's going to happen. There is the possibility that we will become infected, or our family members will become infected. It's not, it's not an impossibility. It is a possibility, and so worrying is normal. But to me, there's a distinction between worry and anxiety. So anxiety is when the worry gets out of control, when you can't stop worrying, where all you're doing is worrying, and that worrying kind of crowds out all other parts of your thinking and really detracts from your quality of living. So, when people have a tendency towards anxiety, it's one of the things that's helpful to them is, there are a number of things that are helpful. One is to learn how to relax yourself. And I know, Chris, you're a meditator and use breathing as a way of calming yourself. And I think that's excellent. But I think another way is for folks to begin to become aware of the kind of anxious thoughts that are kind of running through their head constantly, like a train rattling on a track that's going over and over and over the same track. And so, I mean, two questions that I think people should ask if they can stand back and observe their own thoughts is how realistic or how probable are these thoughts? And then how helpful are these thoughts? So, you can say, if I go to the supermarket, I'm going to have some worry that I'm going to catch something. And just even though I'm wearing a mask and I've got gloves on, I'm taking precautions, there is still some chance that I'm going to catch something. But if you go to the supermarket and then for days afterwards, you're just consumed with worry that, oh my God, did I touch this? Did I not touch that? Did I move my mask around on my face? Did someone get more than 6 feet from me? And just you're kind of going over and over and over in your mind. That's not realistic. It's not probable that anything bad happened, and it's not helpful to you. It doesn't thinking about what happened doesn't make you more safe. Or thinking about going to the supermarket and thinking about, okay, well, what if I go at 6 in.the morning rather than 6 at night? Will that make it better? I actually did that one time. I went to the supermarket at 6 in.the morning and it was packed with people, all who were trying to avoid people like me. They were all there. We were all there trying to avoid each other, but we were all there. But the point is, we're taking a certain amount of risk just in being alive now. I mean, because there are risks out there, but we don't want those risks to just loom so large above us that we have no life otherwise. And that's what anxiety is. Anxiety is where the worries overwhelm everything. And so to be able to calm oneself and also to be able to stand back from those thoughts and to judge thoughts as not helpful or not realistic, and then change those thoughts. You know what? It doesn't make sense for me to go on and on and on about what happened when I went to the supermarket 2 weeks ago. It's done and over with. I got to move on from here.
I know for me, and what's been helpful for managing my own mental health, I had heard years ago, and I'm sure this is something that's pretty commonly said within psychology, is that so often depression comes from experiences or feelings from the past, and anxiety is feelings of worry about things that haven't even happened yet, that are in the future, and neither of them are about like this present moment and what you are doing in this present moment. Um, and that's always been really helpful to me to acknowledge.
I think that's very wise. I mean, I agree with that. And the difficulty is that it's very hard for us to stay in the present. I mean, I don't think that's what we naturally do. I think, we tend to kind of dwell on like what happened. Okay, what happened yesterday? What did I said this to this person? How do they accept it? Did they react as if they liked what I said or didn't like what I said? We kind of run that through our minds a lot. Or we're saying, oh my God, I got to do this tomorrow, and how am I going to do this? And will I get this done on time? And do I have enough money? And then we're focused on the future. But to be in the present, to kind of to be here now, to quote the title of a famous book, is takes a lot of practice and discipline. And one of the things about learning to do breathing exercises or learning to do meditation is that if it brings people's attention to the present. Another really simple psychological trick that we a lot of therapists use is called the five senses. And I'm sure you're familiar with this, Chris. And that is, at any one time, when we're worrying too much about the future or despairing about the past, for us to say, okay, well, let me get myself into this moment. So what is it I'm seeing right now? What am I hearing right now? And what am I smelling right now? And what am I touching right now? And I think I missed one of the senses along the way because I only got 4, and I know we got 5, but you get the idea. The idea is to focus in that moment on whatever your sensations of the world are. And that has a very nice tendency to kind of bring you into this moment. And when you're in this moment, you're less likely to worry, and you're less likely to obsess about the past or despair about the past. So 5 senses is another simple technique people can use.
Something else that you had said to us when you were meeting with our team of community health workers that I thought was really helpful was, if you can't change the situation, try to change your reaction to that situation.
I mean, what else can we do? I mean, I'm a big believer in the serenity prayer. I mean, I think about the serenity prayer, and I talk about it with people every day. So, God grant me the serenity to accept the things I cannot change, the strength to change the things I can, and the courage to know the difference. Excuse me, I screwed that up. The courage to change the things I can, and the wisdom to know the difference. So you wouldn't think I'd know this every day if I screwed it up that way, but there you go. But I mean, this idea of there are things that are going on in our world right now, like the fact that there is this virus about which we can do virtually nothing. We can protect ourselves. We can practice good safety, which will decrease the risk, but we can't change the fact of the virus. So we have to start not with complaining about the virus or worrying about even worrying about the virus. We have to just accept that right now at this time we are living with a virus that for some people is life-threatening. And then the question becomes, okay, how do I then change what I can? And most of what I can is to change the reaction to this virus. So how am I going to approach this virus in a way where I'm going to live my life the best I can, given these new limitations, and I'm going to try to manage my own emotions the best I can, so that I keep my focus on the things that are important, that I'm not becoming so overwhelmed that I stop functioning, but that I continue to be a good father, a good husband, a good worker, a good friend, a good neighbor, that I do what I can, even given the reality of the situation.
Another great exercise that you had given us was, you said something along the lines of, imagine yourself 5 years in the future, thinking back on how you handled this. And that is so simple, but I thought it was really helpful, and then for me, it reminded me to, like, kind of just go through this and handle myself in a way that I can be proud of, right? And knowing that I can make those decisions right now, rather than, 5 years down the line looking back and saying, oh, I could have done things a little bit differently. But just acknowledging it right now in the present moment, I think it's a great little exercise.
To me, that's an exercise about trying to see the forest for the trees. So, every day we're surrounded by trees, and each tree kind of represents a difficulty or a challenge or a problem that we got to handle. But the big forest is, how do we conduct ourselves with our moral and personal and spiritual values so that we are being the people we want to be? We're being the father, the mother, the son that we want to be. And it's very easy because the trees themselves can be so overwhelming. It's very easy to get lost in them. But to be able to stand back and look at the larger forest, the sense of purpose we have about what we're doing matters a lot. And this question is, how do you think you're going to look back on this time 5 years from now? And how are you going to judge how you did during this time? So that question basically pulls you out of the trees and puts you at a remove so that you can look at the forest. And so you can say, you know what? It was hard and I dealt with lots of problems, but I think I did a good job. And to be able to say that I think I did a good job is basically saying I muddled through all right. And that's really the best I could do. And I'm proud of myself for having done that. And so I have found that question to be very helpful to remind people that in the long run, it's not the trees they're going to be thinking about, it's the forest.
And we have you for a few more minutes here, and I would love for anybody that is watching, if they have any questions, to throw them into the chat. And while we wait for people to do that, I just want to mention that us community health workers, our job, as I mentioned earlier, is to connect people to services and try to fill needs as best as we can, right? Or at least direct people in the down the proper paths. And we're still doing that, even though that we're home. So we want people to reach out to us and not feel like because our office is closed, like we're not doing the work anymore. So I'm gonna add a link in the chat for everyone. And you can visit that link, fill out a quick 10-question little check-in about some of the needs or concerns that you might have. That information will come back to us as the connectors, and one of the connectors will reach out to you and see how we can start to address those things. So that link is in the chat there. And these virtual health hours that we're calling, we're going to have another one next week. We hope to do them regularly throughout the rest of our stay-at-home orders. Next week, we will be covering tenant rights, which is really, really critically important, because I don't think anybody knows what tenant rights are, especially right now, when you have so many people out of work, so many people that may have already been struggling to pay rent previously and now are unemployed or waiting for their employers to open back up. So next week, next Thursday at 3 p.m., we will be doing another one of these focusing just on tenant rights. No questions. So there doesn't seem to be any questions coming in. Barry, do you have any wise words to part with?
I do see one question that just came in. Are there any specific grief counseling resources available? So I'm going to give you a kind of roundabout answer. So first off, any mental health therapist will be very experienced doing grief therapy, because grief therapy is kind of bread and butter issue that comes up in therapy. And there are people who really have a very difficult time grieving, and that affects how they function over long periods of time. I think that many church groups and other religious groups provide a lot of solace for folks and a lot of counseling for grief. I also will tell you that in my own personal experience and in my professional practice, I'm a strong believer in using whatever rituals are available to us. So, we have different cultural and religious traditions around funerals and wakes and shivas. In the last 2 weeks, I attended 2 virtual shivas, one last night, and they're a little different than the in-person kind of thing, but they're interesting. But I think the idea of being involved in a community ritual where everyone is together grieving for the same person, and people are supporting one another, that really is very uplifting, and it kind of community sanctioned ways for people to express feeling and to feel validated. So I'm a big believer in rituals. And then for some folks, it may not be a faith tradition that defines your ritual. You may create a ritual. So you may go to scatter ashes somewhere, or you may sing a song that reminds you of the person, something that they loved. So all of this is part of grief, dealing with grief as best we can. Again, grief is another very normal emotion, and it's one that doesn't go away usually in a couple of weeks. I mean, grief is grieving someone who's close to you, who's died, is a long process, and is really, to me, goes on for months and months, and we have to be patient with ourselves. But at the end of grief, what we hope is that people will have a better appreciation and a cherishing of the person that they've lost, and that the happy memories of that person will not crowd out whatever sad memories we have of how they suffered at the end of their lives. And that's hard because human beings are kind of designed with a memory that the most emotionally charged memories tend to kind of have a power in our memory that overwhelms some of the other memories. So we may have seen our loved one while they was struggling for breath at the end, or we may have talked with them while they were in the hospital, and those images and those sounds may make it hard for us to remember when they were hale and hearty. So for some folks, when they're ready, it's a good idea to bring out the photo albums or watch the old videos and remind themselves of who the person was, because how they died at the end from COVID or any other cause is not the entirety of their lives. We need to make sure that we don't mistake the end of their lives with the entirety of their lives, and we really take into account who they've been to us in our lives.
So Cass followed up on that, and this is where I was going to get to, because my family lost somebody to COVID, and she was also named Cass, actually. She was 97 years old in a nursing home, and got COVID in her nursing home. So we found out Thursday morning that she was positive for COVID-19, and she was gone Friday morning, right? And it happened really quick, and we couldn't do. A couple of my cousins had gone up to stand outside of her window, and that's all that you could do. And it feels in some way that grief is on hold at the moment, right? Because there has been it's hard to acknowledge the ones that we're losing, especially in these nursing homes, because she passes and then we can't really do anything right now. We can't do anything about it. We can't even meet up as a family to grieve together, right? And then so it does, like, grief is something that right now is like I said, it feels like it's on hold. And when we get to the other side of this, I think a lot of grief is going to come rushing in really quickly. Um, when we finally get to see our loved ones and kind of let go. I think, you know, a lot of grief is going to come at once is what I feel.
First off, Chris, I want to say I'm sorry for your loss. I mean, it sounds like Kat's lived a long life, and hopefully it was a good life, but even so, it's a loss, and it happened very suddenly. I think different families are going to do this differently. I mean, I have one client, a 37-year-old woman whose mother just died in the ICU probably 3 weeks ago from a COVID. And I mean, she suffered terribly. She's still suffering because she couldn't be there with her mother at the end. And she couldn't even see her mother's body after her mother died. And instead, she has a box of ashes now. And so I think that the grief that she and her family members have has been delayed. But what they've done is they had a teleconference gathering. You know, they had people on Zoom talking about the mother, and then later on they'll do, when it's safe, they'll do a ceremony where they will scatter the ashes, and that will be a kind of second stage ritual. But yes, this is awfully tough. I mentioned that I was on a virtual Shiva, which is a Jewish ceremony for grief, last night, and I was on another one the week before. The week, you know, last week was there's about 100 people on the Zoom at once, and this was a man in his 60s who had died of COVID, and it was extraordinary to see so many faces. Everybody had their video on. You could see this whole gallery of faces. And it kind of brought it enabled people to be there, sort of, you know, there, who might not have been able to go to a funeral. So there was that advantage of the technology. And so it served some helpful function. It also wasn't the same as being there.
Yeah.
But, you know, we're making do the best we can. To your point about will the grief hit us later, about lots of things, about lost people, lost jobs, lost routines. Yes, it will. I mean, we're kind of on emergency footing still. Later on, this is going to be really tough for all of us. I'm sure you're right.
I'm going to ask one more question before wrapping this up, because it's going a few minutes longer than I thought it was. But we will address any questions that come up. I'll make sure we get answers for those. But one question that came in from Smooches, which I think is really, you know, it's pretty specific to Kensington, is that how the feeling so helpless being trapped in your home when you see all of when you see the opiate crisis playing outside of your house and the homelessness crisis going on outside of your home, and now you're stuck in your home. So those two things, this pandemic and, you know, the pandemic that we've been experiencing in Kensington already, aren't necessarily related, but I think now there's a compounding of these two crises happening at one time. So do you have any kind of advice on how, you know, how to manage that, dealing with this new crisis, this new public health crisis, while we were already in the middle of another?
I mean, extremely difficult question, Chris. I mean, from my conversation with you and Smooches and many of the other folks at New Kensington Community Development Corporation, I have heard, you know, long before COVID, I've heard a kind of grief about how Kensington has been changed by the opioid epidemic. You know, people who grew up in this neighborhood, who remember it a certain way, and the neighborhood has now changed because of opioid problems. And I think, you know, many of you have been grieving and also angry that your community's been changed. And that is one of the things that has motivated you to do the work that you're doing. So if you're if because of COVID, you're now stuck at home, kind of looking out the window and seeing the opioid epidemic, but not the real life, not the real Kensington that you want to see, I think it's just making, as you say, making worse a situation that's already existed a long time. And I just think all of us, I mean, first of all, I have great fear for the people who are still out there because of opioids and because of COVID. And they're much more likely to get sick because their immune systems are suppressed than any of us. But I also have think that all we can do is again, accept what we cannot change and then have the courage to change the things that we can and vow to ourselves that we are going to redouble our efforts to make Kensington the kind of neighborhood that you grew up in or that you want your kids to grow up in. And that the folks that have the opioid problems that they have, that they will find their way and receive the care that they need and not be lost on the streets of Kensington. You know, I think Kensington has some of the worst challenges in Philadelphia with that double pandemic, as you say, and I feel for you, and it's one of the reasons I'm so happy to be working with you and you know NKCDC, because you guys are working so hard to try to make a difference in a place that needs all the help it can get. So I'm glad to be helping you in my small way as well.
Thank you, Barry, for joining us. This was a fun conversation to have about some not so fun circumstances. So thank you for being the first guest, and then thank you to the rest of the CHW team. I know I'm the one on this chat, but there's 9 of us, and they were all incredible in helping put all this together. So thank you, everyone. We'll share the links on how you can access that screening tool that I had mentioned earlier. We'll share those links on our social media. And please, we encourage people to fill that out. So we can get in touch with you.
Yeah. Good luck all. Be safe, be well, keep strong.